Good day, I'm Mona Lisa Domingo, student nurse from NAS SN 2023, and I'm going to perform teaching client to use incentive spirometer. The goal of this procedure is that the patient accurately demonstrate the procedure of using spirometer. For equipment, we need to check for incentive spirometer. And for the implementation, first, review chart for any health problems that would affect the patient's oxygen status. Number 2, bring necessary equipment, bedside stand, or overbed table. And then perform hand hygiene and put on PPE if indicated. And then identify the patient, close curtains around the bed and close the door to the room if possible. Explain what you're going to do and what you're going to do to the patient. Assist the patient to an upright or semi-Fowler's position if possible. Remove denture if they fit poorly. Assess the patient's level of pain. Administer pain medication as prescribed if needed. Demonstrate how steady the device with one hand and hold the mouthpiece with the other hand. Instruct the patient to exhale normally and then place lips securely around mouthpiece. Instruct the patient to inhale slowly and deeply as possible through the mouthpiece using nose. If desired, a nose clip may be used. When the patient cannot inhale anymore, the patient should use his or her breath and count to 3. Check position of gauge to determine the progress and the level attained. If patient begin to cough, splint an abdominal or chest incision. Instruct the patient to remove lips from mouthpiece and exhale normally. If patients become lightheaded during the process, tell him or her to stop and take a few normal breaths before resuming incentive spirometer. Encourage the patient to perform incentive spirometer 5 to 10 times every 1 to 2 hours, if possible. Clean the mouthpiece with water and let it dry. Remove PPE if used, and then perform hygiene and document.